pieces of work that we do in public health is trying to reduce inequalities in health between different subgroups of the population. So we're always wanting to make sure that any policy is thought of in terms of its health impact, but also its health impact on different subgroups, so whether that's women or ethnic minorities or other subgroups of our population. And a lot of our work is trying to improve the outcomes, not only for our whole population, but for those subgroups within it, and particularly addressing inequalities and poverty. One issue that's been, I think, very important, and I think really shows how important a woman's perspective is work that we've been doing on period poverty across the UK. In Scotland now, they do provide free sanitary protection to girls and young women aged 14 to 21 in schools and colleges. In England we don't have that, but in the borough that I work in, we've been working on what we call the Red Box project, which is getting donations of sanitary protection that we can then distribute to schools. Because in the UK it's estimated that 10% of young women and girls can't afford sanitary protection. That has a massive impact on their mental health, their ability to socialise, and on their education. It's because obviously populations are not single entities. They're made up of many different communities, many different interests. So by having more diversity in the workforce, it makes it much more likely that we'll be able to interact correctly and understand the needs of our whole population. In terms of water, sanitation and health, obviously in the UK we do have good clean drinking water. In public health we get involved if there are any issues with drinking water, and my colleagues who work in places close to the sea will also be involved in clean seawater and making sure that sea bathing and so on is safe. But for me, I think one of the things that obviously we do a lot of work as well in the UK, we have floods. And making sure that we respond appropriately to flooding. And again, there's a gender issue there, because being flooded is appalling for anyone and anyone's mental health, but often women and men may experience that differently. So it's really important that we have that female perspective. Looking at population health, having a diverse workforce means that our population is better able to engage with us. I know that people will have conversations with me, because I'm a woman, about things to do with childbirth, breastfeeding, childcare, that they might not feel comfortable, and we've talked already about menstruation, that they might not feel comfortable talking to a man about. So I think it's really important that we have that diversity of input from different, so that we can have those different perspectives reflected. I would say that any woman or girl wanting to join public health, it's a fantastic career, it's really interesting. It's really important that we do get that range of women's voices in public health and in the policy making. You can come in the UK, you can come into public health either from studying medicine or another career, where you typically with a lot of where you've got experience in health or a related health policy field. But it's a really interesting job and very, very varied.